Hello, Partnering for Vaccine Equity Learning community members, and welcome to this afternoon's learning event. I'm Bridget Courteau. As many of you know by now, I am the Director of Group Learning for the community. And on behalf of our team at the Urban Institute, thanks for joining us today. The organizations participating in the Partnering for Vaccine Equity program are working with many different priority populations. And the population that we're going to focus on today, young adults, is a segment that we've heard many of you are interested in engaging. Young adults themselves can be a target for vaccine promotion activities, of course, but they might also be the trusted messengers to other adults in their families, as we heard about during last week's webinar on COVID vaccine misinformation in the Latino community. And today we're going to hear from Erin Hemlin at Young Invincibles, who will share some very recent research on young adults and their attitudes about COVID vaccines. Before we go further, I'll do our typical very quick review of how the session will work. You've all been muted upon entry to the session. There are a lot of us, so staying on mute unless you're speaking is key to keeping the discussion going without distractions. You do have the opportunity to speak your question rather than type it into the Q&A. It's your choice. If you do want to speak your question at the Q&A portion, which is at the end of the session, the last 15 minutes or so, if you want to speak your question, use the raise your hand feature and we'll unmute you. If you want to type your question, you can use the Q&A tab at the bottom Zoom panel, and you can do this at any time during the session. The chat room feature is also open today, and we encourage you to chat amongst yourselves as you'd like. But please use good chat room etiquette. And by that, I mean, don't post questions for the speaker in chat because we might not see them there. And please be civil to one another and to our speaker while you're chatting. And finally, as with all of our learning events, we will post the slides and a recording of the event to our community website and through the digests that go out through the CDC managed adult vax program listserv, which all program members should be a part of. If you have technical difficulties at any point during the session, send an email to our community managers inbox, vaxequitylearning@urban.org. We'll monitor this and try to get you help as soon as possible. So I do have a couple of slides and a request for the learning community members before we get to our featured presentation for today. So this fall, the group learning manager team will begin launching communities of practice. A community of practice is a group of people with a common concern or problem or passion about a topic who enhance their knowledge and their expertise by interacting regularly. You, the members of the learning community, will have opportunities this fall to join a community of practice. And there are three key components to a community of practice. As noted, there's some sort of shared interest. There's a setting or an environment that facilitates interaction so that members of the community have the capacity to interact with one another regularly. And there are shared practices, shared experiences, tools, ways of addressing problems. Next slide. We are still hammering out some key design features of our communities of practice, but we know a couple of things already, which is that the communities of practice members, that is the learning community members who choose to be in the community of practice focused on a specific learning area, will be the ones driving the process. And by this, I mean, they're going to be the ones, you all are going to be the ones sharing your needs, your experiences, your expertise and your materials with each other. And as long as you are able and willing, also serving as chairs of the community or steering committee members. Our role is a little different. As learning community team members, we will support communities of practice by creating the space for communication and sharing via our website, coordinating regular meetings so that you all can connect, share your work, and identify shared needs, and then engaging outside experts as needed to share their expertise with the community of practice. So why am I even telling you all of this when you came to hear about young adults? Well, we have a captive audience, of course, and I would appreciate if you could all take a moment before we get to the featured presentation and respond to a very quick poll about organizing the communities of practice. So one of the design decisions that we are currently wrestling with is the best way to organize communities of practice. There are many different options. So we're going to launch a poll right now. And it should only take a minute or two for you to read through the options and select one that would work best for you. So this question asks, of the different ways that you might organize a community of practice, what type of way is most interest to you? Organization by geography or population that you're working on, activities that you are working on, the level that you're working in, community-based all the way up to national, or some other type of organization. You cannot enter free text into a poll, but if you do have another idea that comes to mind right away, please put it in the chat and we'll grab it out of there. And we're also going to be putting a very similar poll like this one on our website, asking folks that are engaging with the website what sort of organization approach they would prefer. Okay, so we're going to leave this up for just maybe 30 more seconds. Okay, thank you for participating in that poll. And now, without any more delay, let's turn to our featured presentation. So it's my pleasure to introduce Erin Hemlin, who is Director of Health Policy and Advocacy for Young Invincibles. So Erin currently leads Young Invincibles policy development and government relations work on access to healthcare, with a focus on the federal marketplace and Medicaid, as well as how young adults use healthcare and specifically mental health care. Previously, Erin led Young Invincibles healthcare consumer education work for 5 years, which focused on ACA implementation and helping young people access coverage directly, as well as connecting partners to young adults in their communities. She's authored reports focused on young adult health and was a contributing author for the textbook Navigating Health Insurance. Erin's work has been frequently cited in the media, including major publications like NPR, NBC News, and New York Times. Erin previously worked for a social change-oriented lobbying firm called the Sheridan Group and for the Congressional Research Service. She serves on the board of directors at the National Alliance for Adolescent Health and enjoys reading and sports, all things sports, in her spare time. Erin's a native Texan and received her undergraduate degree from St. Edward's University and a graduate degree from George Mason University. And with that, Erin, I'm going to hand it over to you. Thanks so much for joining us.
Great. Thank you so much. It's so wonderful to be here. Really appreciate Urban Institute for putting this together and inviting me to participate. And thank you so much to all the attendees for joining us today. You could go ahead to the next slide. For folks who might not be familiar with us, I'll give a quick intro to Young Invincibles. Young Invincibles, or YI, is a national nonprofit organization dedicated to expanding economic opportunity for young adults 18 to 34. We actually got our start back in 2009, 2010 by young adult organizers who wanted to make sure that young adult voices were part of the fight over healthcare reform at the time in Congress, what eventually became the Affordable Care Act. After leading somewhat of a grassroots movement to elevate young adult voices in healthcare reform, they started the organization in part to see through implementation of the ACA and help young adults get connected to health coverage. We've continued to do that ever since. We've expanded to work on higher education, workforce, and some student voting issues as well. But in the healthcare kind of public education space, we have been working on ACA implementation and helping young adults understand how ACA coverage works, how Medicaid expansion works for the past 10 years. We really thought that using that experience, kind of what we've learned in healthcare outreach best practices to young adults, was really transferable to this work on helping young people get connected to the COVID vaccine. So we started up this new campaign over the last couple months to do just that. You can go to the next slide. Oh, there you go. This is our intro slide. You can go ahead to the next one as well. Thank you. So to do that, we have our own kind of developed and fine-tuned outreach best practices that we've employed on access to healthcare and mental health for the past several years, but really wanted to do some qualitative research with young adults about the COVID vaccine itself. As I'm sure you all have seen, there are a ton of surveys and polling out there about attitudes and feelings among all adults, including young adults, about the vaccine, but not as much of that kind of qualitative research to really complement some of that polling. So that's what we set out to do. We did what we called a listening tour, where we held 9 focus group-like discussions. We called them facilitated discussions with about 85 young adults all across the country, all between 18 and 34. The goal of this listening tour was, again, to really identify those motivations to get vaccinated, opinions, fears, concerns about the COVID vaccine, to kind of break down why some young adults were not getting vaccinated at the same rate as older adults. We finished that tour. We ran that from April to the end of July. We have produced our report, which actually was finally published today. I'll make sure and drop that report in the chat for you all. And then in addition to the qualitative research, we've also been doing our own outreach. So again, this is kind of phase 1, phase 2, but a little bit of happening at the same time. Over the summer, doing outreach within our communities where we have offices on the ground to reach young people through peer-to-peer education about the vaccine and hear a little bit more from young people directly about why they may or may not be getting vaccinated. And then we're hoping to turn all of this into an updated outreach best practices for partners to use on webinars just like this about what we found and what we think might help other partners and other folks in communities who are doing this work to reach young people. Okay, can you go to the next slide? So here's a quick breakdown of some of the young adults that we spoke with. Again, we spoke with about 84 young adults across 9 listening sessions in 5 cities. We have offices in DC, New York City, Denver, Chicago, Houston, and Los Angeles. All focus groups took place in those cities. So that's kind of the representation of the young adults that we spoke with. All between 18 and 34, although they leaned a little bit closer to the younger side. Median age was 24. They were heavily female, about 68% identified as female, 24% male, and another 8% is non-binary or gender queer. A heavy proportion identified within the LGBTQ community, about 30%. And it was heavily people of color. So about 38% Black, 22% Latinx or Hispanic, 15% Asian, 11% non-Hispanic white, 10% with multiple identifications chosen. This was really important to us and really intentional. We wanted to specifically reach out to young people of color. And we are happy with those results here and plan to do so again in future iterations of this. In a pre-survey ahead of the focus group itself, we asked about their current vaccination status. Among those who filled out the report or filled out the survey, about 75% were either vaccinated at the time or said that they would do so as soon as available. And about 24% were unvaccinated at the time of the discussion. Among those who were unvaccinated, as you can see here, about 2/3, 66% said that they definitely or probably would get vaccinated, and another 35% said that they would not or definitely would not get vaccinated. All right, can you go to the next slide? Okay, so I want to dive into a little bit of what we heard in these focus groups and that we can go into some of the recommendations and outreach best practices that we heard. But starting off of kind of like the main reasons among those who are unvaccinated, the reasons why, more than anything else, was some form of misinformation. Some form of confusion, misinformation, not feeling like you had the right amount of information was by far the #1 reason folks either were not vaccinated yet or hesitant to get vaccinated or kind of in that wait and see camp. Interestingly, even among those who were vaccinated, who got vaccinated as soon as it became available to them, they still reported a lot of confusion and a lot of skepticism about the vaccine. Breaking this down a little further, you could see how it really kind of ran the gamut. We heard from a lot of young folks who felt that young people were not really prioritized, both in the vaccine rollout and in general. That, they heard things like young adults are at low risk for COVID. The reasons that they are prioritized last is because it's not necessary for young people to get vaccinated, all the way down to some of the more kind of conspiracy theory things that we heard about, like microchips and things like that. But some form of misinformation or overall confusion, not understanding the guidelines, was by far the top thing reported among both the vaccinated and of those who are not vaccinated. In addition to feeling misinformed, feeling like they didn't have the right accurate information, the second top concern was around side effects. We heard this quite a bit, especially in the beginning, in the early rollouts in April and May, that a lot of folks were scared that the side effects from the vaccine were going to be worse than COVID itself. That came up time and time again, as well as this kind of really rational thought of, if I have to skip work to get vaccinated, and then I have to skip work the following day because I, am experiencing flu-like symptoms from the side effects, that could be missing, somewhere from 2 to 4 days of work. And I can't miss that much work. I won't be able to pay my bills that month. So that seemed to be one of the kind of top issues, both kind of the concern over side effects, and then the real kind of systemic access barriers that come along with that. I included a link on here from a young woman participant who said, if I skip one shift at work, that's $80 that could make or break rent for that month. This young woman was working as a nanny, which, as someone who's working a gig worker type job like that, you might not necessarily have the option of paid time off. That also came up quite a bit of, when we talked about the options of paid time off in order to get vaccinated, young people spoke to, that's not the type of job that I have. That's not an option for me. So really feeling the strain of, if you're missing any time off work, that is just that you can't afford to do that. And then this fear of side effects coupled with that, where you might be missing a significant amount of time off work. And then alternatively, sometimes this belief that that's worse than getting COVID itself. I could get COVID and not be sick at all, versus I get the vaccine and I'm potentially sick, 2 to 4 days from the side effects of the vaccine. And then lastly, I think, coupled with all of those things together, again, the participants were mostly young people of color. And of course, we heard a lot of skepticism about government and the medical system in general. There was a lot, particularly among the young Black participants, a real kind of distrust of government and distrust of the healthcare system. And not just because of, the historical atrocities that we've all know about and learned about, but just their everyday experiences. I mean, I think this came up quite often. I said, I experience, microaggressions and discrimination and racism when I go to the doctor right now. It doesn't appeal to me to do that when I don't feel like I have to, if I feel like I'm healthy and I don't necessarily need it. So I think that's really, really important to point out, as others have done in their studies, that it is not just kind of the Tuskegee experiments. It is, everyday racism in our healthcare system right now that is deterring, particularly the quote unquote younger and healthier folks from wanting to interact with the healthcare system. Next slide, please. Okay, so again, I think in addition to misinformation, and really think misinformation itself is a type of access barrier, but we heard a lot of issues with just systemic access issues when trying to get vaccinated, not necessarily, again, a hesitancy to get vaccinated or not wanting to get vaccinated, not wanting to be healthy, not wanting to, or not believing that it is necessary, but real systemic issues when trying to access the vaccine. After misinformation, transportation came up quite a bit. There's another quote in our paper from a participant who, said at the time when the vaccine first became available to them, they didn't have a car. The vaccine sites was far away. And, they're basically like, I have to get a ride twice. That's putting, that means I have to make sure I have time to go to the vaccine site, find someone who can drive me, make sure they have time to do so twice. That is just a lot of logistical barriers in order to actually go there and get their vaccine shot. Internet access issues came up quite a bit. I think this also is something that people probably don't associate as much with a young adult audience, thinking that a lot of young people are kind of internet savvy and tech natives, which of course, is true, but that doesn't mean that they always have the ease and access of finding the right information, finding vaccine sites that are near them, especially in the beginning when there are multiple portals and it was unclear where to go for the right information. That came up a lot as well as with young adults who helped older family members trying to navigate some of these websites and portals in the beginning, signing up their grandparents for appointments in the beginning, which was a hassle. A lot of sites froze and had issues. So they still had that in their memory by the time it came for their turn to get vaccinated once they became eligible. Time off work, again, of course, that's something that I already mentioned, but that was a really big one that came up quite a bit, as well as concerns over documentation, both insurance status and immigration status. We talked about a fear of cost quite a bit associated with all of these things. Even when we said, the vaccine is free and it's available for everyone, regardless of whether or not you have insurance, regardless of whether or not you are a citizen, there's a lot of skepticism and a little disbelief that that would actually be true. Often they would say things like, well, they say it's free, but I'm going to get a bill in the mail later. I'm going to have a copay, something like that. And then language access came up as well. And again, this came up in the context also of helping family members. For example, we had one young adult participant who spoke English as a native English speaker, but her parents were not, and felt that she didn't have the right tools to be able to translate as well as she wanted to in Spanish, or at least didn't have the right materials to point to. And it felt like it was all on her, and then that was a little overwhelming and causing some anxiety. Next slide, please. Okay, so a couple other things I wanted to touch on. Again, these focus groups ran from April to July, so it was before some of the kind of larger mandates around vaccine requirements started coming out for like state employees, for example. However, over the summer, particularly, we saw a lot of colleges and universities start to begin to require that full-time students, staff, faculty would be required to be vaccinated in order to return on campus in the fall. We asked the young adult participants about this, and surprisingly, I think we thought that we would get a little bit more pushback, that there would be a little bit more of an adverse reaction to this, and there really wasn't. We heard from a lot of the young adults that some of them, their schools or colleges had already required it. Others were working in frontline worker positions who had employers that were requiring it. And they seem to be pretty positive and pretty open to it being required by an employer or by a college or a university. I think to some extent, it seemed like we actually had some young adults who said that they were essentially waiting for that. They're waiting for somebody to require it, and then they would go ahead and do it. And it seemed to some extent be a couple of different things. Some, it's that is in fact a trusted messenger, a trusted authority figure that's a little bit closer. So it's not your state officials, it's not federal officials that feel a little far away. It is, your employer that you trust. If they say, you need to get this done, they'll do it. Others, it seemed like just kind of taking that decision off their plates was a relief, and said, I don't have to anguish going back and forth whether this is the right decision for me. Once it's required, then I'll just do it because I have to. And then we heard others who said that they got it done because they heard it was required to travel, or it was required to go to a music festival. And then they were like, well, okay, now I'll go ahead and do it. And it seemed to be in those cases, it was a little bit of just pushing it off until they had to do it in order to do something that they wanted. But overall, really more positive reactions than you would think, even among those who were not vaccinated, and a little bit still in that kind of wait and see hesitant camp. The other kind of big red flag for us that came up in these discussions was about booster shots. So again, this was before any of the guidance about booster shots came out, but we asked about the idea of getting a booster shot in the future. And nearly, again, across the board, enthusiasm just plummeted, even among those who got vaccinated as soon as they possibly could. The idea of having to get a vaccine on an annual basis or any kind of repetitive basis was really, really not appealing to the young adults that we spoke with. And that also seemed to be for a variety of reasons. Some folks said, if it's like the flu shot, they're like, oh, this is fine. It's like a flu shot. You get the flu shot every year. And we would say, oh, so do you get the flu shot? And they say, well, no, I'm a young adult. Like, young people don't really need the flu shot. I don't need that. I'm not going to do that. So we heard variations of that. We also heard folks who said, I don't really want to feel like I'm dependent on it. Other folks who said, well, it's free now, but is it going to be free in the future? I'm not going to get it if it's not free and it's easily accessible. So really, I think something for us to think about, if and when we get to the point that it is recommended for all adults to receive a booster shot, we're going to have to do a lot of outreach and a lot of messaging and a lot of education to young adults on why that's important for both their health and the health of the community at large. Next slide. Okay, so in the next two slides, I just wanted to touch on a little bit on some of the outreach practices that we are doing currently and what we're planning to do in the fall. Over the spring and summer, it's really been a mix of kind of virtual work and on the ground or in-person work, depending on where it was safe to do so. But we've been doing virtual phone banks and text banks to young adults in our networks to make sure that they have all of the information that they need. We've been doing some kind of pop-up events at vaccine sites. Our California office actually did a art installation in a mural, which is pretty cool. It's a mural about the vaccine and has a little QR code that you can scan to get more information. And we'll be doing lots of workshops and presentations to young adults, a lot of peer-to-peer outreach. We have a network of young adult advocates across the country that will be doing this work going into the fall. To really kind of get at some of the concerns that we heard in this series of focus groups, and make sure that we are addressing people's questions and getting them the information that they need. You can go to the next slide. Yeah, so a few thoughts on next steps. This is a graphic. I know it's a little hard to read, but it's got some of the recommendations from the report. And I think they already dropped the report in the chat. Thank you for that. But you can read more there, and this will be clearer and easier to read. But I think, again, with misinformation being the biggest issue that we found in these focus groups, I think the clearest, outreach best practice, messaging best practice we can share is just addressing these concerns in an authentic way, I think respectfully addressing concerns around infertility. I mean, that came up quite a bit in our focus groups. Because again, we're talking to a lot of young women who might want to have babies in the near future, and they hear anything related to infertility, it is a huge red flag and say, well, maybe this isn't right for me. But I think when we're thinking about doing outreach, particularly us, we're doing a lot of peer-to-peer outreach, we want to make sure that, this is not a crazy idea or a crazy notion, right? There have been issues, particularly with women of color who've experienced, government sanctioned sterilizations in the past. So I think we want to be very respectful in how we address some of that misinformation, where we can provide clear, credible information, real clear guidance on what's important, how you can find more information about the vaccine, where you can go to get vaccinated from a trusted messenger that and it's going to resonate with that community that you're talking to. So I think, again, this is the third recommendation on here, but one of the things I think when we're thinking about outreach to young people, obviously peers is a huge motivator. I think young people who, in our focus groups have said this, and throughout our work have said this, that, it really is, it's your friends who you trust. So I think we really want to utilize that kind of young adult army that we have to do some peer-to-peer outreach, but at the same time, there is no single answer to reaching all young adults. It's going to take a multitude of trusted messengers. For some people, it might be their friends. For other people, it might be their church leaders. And for others, it might be, their local city council. Who knows? It takes it's going to take everyone to reach all young people across the board. But again, I think we need to find them where they are. That's the second bullet on here, and address some of those systemic access issues that we talked about, that we need to go to their places of work, go to campuses, go to grocery stores and pharmacies. A lot of the young adults in our focus group said, oh, the vaccine should be available in grocery stores, which at that point in time they generally were, but they didn't seem to know that. So I think, again, making sure that we are getting the right message in front of the right audience and making sure folks know about the resources that are available, and then spreading that message around as much as we possibly can through as many trusted messengers as we possibly can. Okay, next slide. And I think that's all. Yep, that's all that I've got for you today. But I'm really excited to dive into any questions you might have about our focus groups or any of the work that we're doing this fall.
Thank you, Erin, so much. And I should have started off by saying congratulations on the report, because I know it's a big effort and a lot of work went into it from you and your colleagues. So congrats. And so I'm going to read you our first question. And folks, feel free to submit them, and we'll also check for hands raised. But this is coming from Ali Hoban, who has asked, have you found any messaging that's helpful to reach people who place their trust in holistic remedies instead of getting vaccinated?
Yeah, and thank you for that on the report. I appreciate it. This is a really great question. This came up a little bit in some of our focus groups. We had a few folks who said, particularly from their upbringing, from their culture, that they do tend to trust holistic remedies more so than Western medicine. One of the young adults in our focus group said that her parents had not been vaccinated. She was really struggling with whether or not she wanted to get vaccinated. At the end of the day, decided to do so, essentially because her friends and her colleagues where she worked on campus were also vaccinated. That's just one example, but I think that is a scenario where, again, I think being really respectful of people's cultures and where they come from and why they might seek out holistic remedies first, but then reaching them with that trusted messenger. And I think in this case, it was the fact that, everyone she was surrounded with on her college campus had at this point gotten vaccinated, and that kind of pushed her to eventually do so as well. So I would say just kind of being patient, sharing information, answering questions as they come up. But ultimately, people are going to make, the decision that they feel is right for them.
So Dawn asks, now that school's back in session and schools required vaccinations, how do you reach those who fell between the cracks? So examples are people who are doing online learning or took a semester off, some, who somehow didn't meet those requirements or isn't as engaged with the school.
Yeah. And I'm not our higher ed expert at YI, but as I'm sure anyone who's in that space knows, it is, we saw a lot of students who have put their career or their educations on hold, who are not returning to campus. And unfortunately, that tends to be students of color, tends to be lower income students who might fall through the cracks, as you said. I think that, again, is why it's really important to go to as many places as we possibly can. We know young adult and college student are not synonymous. Not all young adults are in college. So while it's important to go to campuses and try to reach as many people on those campuses as we can, we also need to go into neighborhoods and go to community centers and go to other places where young adults are to try to reach them. I think, again, mobile vaccine sites and kind of going into some of the communities that have been a little quote unquote left behind is a way to get at not just young adults, but others who, potentially have fallen through the cracks because they don't have that kind of connection to a system.
I'm going to combine a couple of questions that are both focused on messaging. So one participant told a story about an activity they did, tables and offered vaccines on site at a high school. And students didn't seem interested or didn't seem to want to talk about getting vaccinated. And so do you have suggestions or pointers for that type of audience where it's really difficult to engage? And then another question specifically about kind of just messaging to support getting vaccinated. So seems like that could be a part two. I'm not sure how much the report has on messaging versus the issue, the concern, and figuring out what the reasons are behind the hesitation or lack of confidence versus how to address it.
Yeah, I think that's a really great question. And it's difficult when folks are, don't seem interested when you're tabling or when you're trying to spread that information. I would say from our previous work on doing ACA health coverage outreach that did a lot of tabling, I think that one of our partners found that it took up to 17 touches before a person would go from kind of first awareness to enrollment. And I think that's a kind of lesson learned or best practice that we need to kind of think about and implement here, where maybe that kind of first interaction with students tabling on a high school campus isn't going to move them. That's not going to move the needle to actual vaccination, but it just kind of getting that, worm in the ear. And then we follow up and we, try to get them on, sign up on a listserv or something where we can send them additional information, and continue to make sure that we're just, getting as much information to them as we can, add as many touches as we can to hopefully kind of get them across that finish line.
So a high touch audience.
Yeah.
Did your work specifically look at the LGBTQ community? So we have a question about the connections between that community and what you learned about mistrust and barriers to vaccination for that segment of the young adult population. Are you able to speak to that at all from your research?
Yeah, I mean, and again, these are anecdotal. It wasn't a huge sample size. We did have a lot of folks who identified within the LGBTQ community. I think that might be partly just by nature of it's a young audience, and a lot of younger people are more likely to identify in the LGBTQ community versus older audiences. But we didn't really see any differences in those discussions between those who were within LGBTQ versus those who identified as hetero, cis, straight, young adults. The Kaiser Family Foundation did put out some research recently on LGBTQ community and vaccine uptake. But just from our research, we didn't see anything that was too different from those groups.
And could you speak a little more about the bullet point on one of your last slides, last couple of slides, University 101 classes? So what are those, sort of what does that entail? That was a way that you're getting your messages out.
Yeah, thank you. And apologies that wasn't super clear. So we have actually done some kind of health education 101 classes on college campuses for a while now. And we're now doing that with vaccine information incorporated in it, or kind of a vaccine only workshop. But I think one thing that I didn't mention, but is important to kind of note too, is just a lot of young people have pretty low health literacy. So they're unclear about how health insurance works, what a copay is, what a deductible is, et cetera. And I think kind of including some of that basic health literacy, health insurance literacy information when we're talking about accessing a vaccine can actually be really helpful. Just kind of clearing out some of those basic questions. So that's actually what that is. It's a kind of a basic, how do I access healthcare 101 workshop? And we're incorporating some vaccine information in that as well.
Is some of that information sort of the primer on health coverage and how it all works, that's in a language that that young adults might respond to? Is that something that Young Invincibles makes available to partners or to like learning community members? Could they access any of that?
Yeah, absolutely. I can drop my email in the chat as well. And anyone who's interested, please feel free to reach out. We do those presentations for literally anyone who's interested, and I can share our slide decks as well. But it is very much meant to be kind of health insurance 101, access to healthcare 101 in plain accessible language.
I think we have time for just one or two more questions. When you were working on the report, did you notice common values or beliefs that that someone working with this population could leverage to increase vaccine uptake in the age group?
Yeah. I mean, I didn't go into the motivations on those who kind of enthusiastically got vaccinated right from the get-go as much, but I think a lot of what we heard from folks who were comfortable getting vaccinated was pretty similar, and it really was this very kind of pure altruistic wanting to protect my community, wanting to protect my family in a way that is also kind of interesting. I think we heard a lot of, I'm getting vaccinated because I live in a multi-generational home. I live with my grandparent. I don't want to put them at risk, which I think was a huge motivator for a lot of young people to get vaccinated, which is great, but also kind of reinforces that, misinformation that young people don't need to be vaccinated for themselves. But that did come up quite a bit of just wanting to protect the community, even if it wasn't necessarily for them, wanting to protect their family. A lot of people who lived on college campuses in 2020 who felt terrified. They're like, I am surrounded by people all the time, and I want to make sure that I'm safe and that I'm taken care of. And then I think in addition to that, a lot of what we heard is kind of a common theme across the board was just a lot of young people who had massive disruptions in their lives. A lot of people who missed graduations, missed kind of those big milestone life events, or had to abruptly leave campus if they were already in college, or missed their entire freshman year. I mean, we heard a lot of variations of that too, of just having, massive disruptions in their life, like losing their jobs, being people or being frontline workers who had to work throughout the pandemic and felt at risk every day, in a way that they were just very vulnerable. And I think that stood out quite a bit across the board.
Yeah, that's an important context. So we're going to stop the question and answer session now. And I know there were a couple questions we didn't get to, but I did want to announce, you all hopefully already know about this through various channels. We've been announcing our learning event next week, which is our first virtual office hour session, and it is actually with Erin. So there's a chance to continue this conversation in a more personal way. So those office hour sessions are typically going to run about an hour long, but they're broken up into 15-minute segments. And we limit participants to 10 slots per session. So it'll be a sort of a small group discussion, or feel like a small meeting environment. Because I know one thing that Erin's hoping to hear about is how some of you all are working with young adult populations, and any ideas that you might have for building that network of young adults to work on this issue. So we have a quick satisfaction poll that I am hoping for those of you who are still on the line, that you will take a minute before we end the webinar to just answer this quick question about the usefulness of this content for the work that you're doing for the Partnering for Vaccine Equity program. And again, I wanted to just plug next week's office hours. And Melanie has just chatted the link to sign up. We also announced it through our website, and we are working on a third event in our young adult series, our September series, where we are currently planning with a couple of learning community member organizations who are focused on this population, to hear about what they're doing and what their peers can learn from their experiences engaging young adults. So hopefully you'll be able to join us for some of those remaining sessions in the Young Adult series. Erin, thanks again, and we will see you next week.
Great, thank you so much.
Appreciate it. And thank you all for taking time out of your afternoon to participate in the session. Take care and have a good rest of your afternoon.